So nitroglycerin is also a new infusion that we're going to carry on board the ambulance. We're using nitro infusions primarily in patients that have pulmonary edema, that are in exacerbated congestive heart failure, that we have on non-invasive ventilation, that we don't want to break the circuit on their BiPAP or CPAP just so that we can give them sublingual nitro. So in these cases, we're going to use nitro by infusion to help with afterload reduction, help bring down their systolic blood pressure, and then that way they can continue to improve from a pulmonary perspective without having to have the mask taken off. To determine the proper dose, you'll have a link from the guideline that will bring you to a chart on how to dose nitroglycerin. It'll give you the dose with an expected volume in milliliters per hour that you're going to administer. Nitroglycerin is not weight-based, so you do not have to solve for the patient's weight as you're giving it. It's going to be given simply micrograms per minute. So the starting dose is 50 micrograms per minute. We're going to titrate every 5 to 10 minutes or so until the patient clinically improves. So some important things to consider when giving nitroglycerin. One, taking a manual blood pressure to verify your non-invasive blood pressure readings is very, very important. Two, it's important not to titrate nitroglycerin too quickly. You don't want to make adjustments before at least every 10 or 15 minutes, because if you adjust more rapidly, you may have more profound changes in the patient's blood pressure. In general, someone who has a history of hypertension does not tolerate well when their systolic blood pressure is reduced by more than 1/3. So for that reason, be very cautious as you're titrating your nitro infusion to not drop the patient's blood pressure too rapidly. As these medications are new in our system, you may have many questions about how to use nicardipine and how to use nitroglycerin IV. If you do have a question while you're taking care of a patient, you're always welcome to use the medical consult line, and we'll help guide you as you're taking care of the patient. If you have other logistical questions about how to set it up, how to prepare the container, feel free to reach out to your field supervisor or a member of the clinical services team, and again, we'll help you walk through that. Okay, the next thing that we're going to do is I'm going to show you how to prepare nitroglycerin bottles for infusion on your Nimbus 2 pump. In some cases, you may have a set of IV tubing that is vented. If you have vented IV tubing, what that means is at the top of the drip chamber, there's a tab. If you pop that tab open, it allows the outside air to come into the drip chamber, so that if you're using a glass bottle, that air can make it up into the glass bottle so that volume can leave the bottle and come under your IV tubing. Otherwise, it would be nearly impossible to get any volume out of the bottle because of the air that couldn't replace that volume in that fixed space. So for that reason, IV tubing often comes vented. So what happens if you need to give nitroglycerin, but you don't have a vented set? Well, that's easy to fix. So in this case, we'll pretend that we don't have vented tubing. And if we have to use our traditional Nimbus setup, what we can do is we can go ahead and spike the bag. Okay? We can turn our infusion and start to run our infusion. And if we get an alarm because it can't pull volume out of the bag, or out of the bottle, then all we have to do is take a 21 gauge needle and take the needle and stick it right next to the drip chamber, and that will vent air and allow air to then make it into the bottle. So when you put the needle in the bottle, when you first start your infusion, you may notice that you have a couple of drops of fluid come through the needle. That's okay. When you start to run your infusion and air starts to be pulled from the outside environment into the bottle, that'll reverse itself. So don't be surprised. It just has to overcome the pressure inside the bottle at first.